almost without exception, we all have stories about addiction in our families. I learned about this disease firsthand from my own experience. The incidence of the disease and the percentage of people who don't get help today is pretty much the same as it's been for an awful long time. Our nation's #1 public health issue is addiction, clearly, with 23 million Americans suffering, 90% not getting the help they need in any given year. The financial impact, the human impact across society is just unimaginable. There are a lot of stakeholders in communities that have a financial stake in solving addiction in the community, but most of them have never had the opportunity to participate in something that generates that value. When we approach employers with community assets that are vital to helping people initiate and sustain recovery from addiction, and we provide services directly to employers in the workplace by sending a fleet of speakers in, for example, to talk to groups of employees. The results have been phenomenal. When a CEO or an HR director stands up in front of a room of 40 or 50 employees, and the CEO begins by saying, there's no reason to hide anymore. We're going to help people in our place of work because it's part of our culture, it's our commitment to people. It's a very powerful message when an organization takes such a stand. We have business owners and CEOs and HR people ready, willing, and able to stand up in front of crowds of people and say, look, this works. And we can quantify how many lives have been saved, families restored, how many productive workers we've been able to retain, and the investment that we've made in the local resource has paid back several times. Well, I'm convinced that during my lifetime, and I'm 58 years old, that I will live in a country that understands and treats addiction like any other chronic disease, and it's really that simple. My name's Kevin Kirby, and I'm an Ashoka Fellow.